Further debate. I recognize the member from Flamborough-Glanbrook.
Thank you, Mr. Speaker. Mr. Speaker, I will be sharing my time with the member from Parry Sound Muskoka. And I'd like to begin, Mr. Speaker, by addressing some of the comments made by the member from Ottawa South earlier this afternoon. And he began today sharing an intimate story about a family member who fell ill and required hospital care. And the member from Ottawa South was concerned about the future of health care under this current government. I have to shake my head. Mr. Speaker, the member from Ottawa South belonged to a party, belonged to a government that almost destroyed this province. The legacy of the government that that member belonged to included a scandal that resulted in the previous Premier's Chief of Staff ending up in jail. Billions wasted under the Green Energy Act, but let's just talk about scandals within healthcare. Do you remember the billion-dollar e-health boondoggle?
Orange.
How about the orange disaster? Those are the legacies of your government. Mr. Speaker, the previous Liberal government that member belonged to ran up so much debt that he's right. The future of healthcare in this province was put in jeopardy. But, Mr. Speaker, the piece of legislation we are debating today, Bill 74, will put the people of Ontario first by protecting our province's public health care system. The People's Health Care Act is designed to ensure that patients can get the world-class health care that they deserve, both today and in the future. Our government committed to the people of Ontario during the election campaign that we would end hallway health care, and we are fully committed to delivering on that promise. The fact is, Ontario's healthcare system is truly on life support. We know that. We've heard it time and again. Patients languish on waiting lists. More than 1,000 patients receive care in hallways in our hospitals each and every day. The average wait time to access a bed in a long-term care home is 146 days. That's almost 5 months. It's unacceptable. Patients and families are getting lost in the healthcare system. They're falling through the cracks and they are waiting too long to receive care. And this has a negative impact on the health and well-being of patients, their loved ones, both physically and mentally. Our government has already made important investments in healthcare right across the Hamilton region and right across Ontario. Last November, the Premier, joined by the Minister of Health and Long-Term Care and the Minister of Infrastructure, were in Grimsby to announce a $500,000 grant to the West Lincoln Memorial Hospital to begin early planning for a new hospital, as well as to fund the continuation of surgical services at the hospital through 2019. This is welcome news to residents in the eastern areas of my riding who rely on these services, including residents of Upper Stony Creek. In January, our government prioritized the health and safety of patients by taking action to provide 128 hospitals across the province with funding to upgrade, repair, and maintain their facilities through the Health Care Infrastructure Renewal Fund. This includes more than $2.5 million for St. Joseph's Healthcare System in Hamilton and over $6 million for the Hamilton Health Sciences Corporation. This funding will help make sure that patients and their families have access to reliable, quality care they expect, they deserve. In last week's budget, our government announced $17 billion in capital grants over the next 10 years to modernize and increase capacity at our hospitals. We are investing $1.75 billion over the next 5 years to create 15,000 long-term care beds, and we are already well on our way to reach that goal. The budget also contains an additional investment of $384 million in our province's hospitals to help end hallway health care and another $267 million in home and community care. All of this is on top of the $3.8 billion we have committed to creating a comprehensive mental health and addictions treatment system over the next 10 years. Mr. Speaker, these major investments are proof that our government is committed to protecting what matters most, and I have to say this over and over again, our public healthcare system. At present, the healthcare system is facing capacity pressures, and the right mix of services, beds, or digital tools doesn't exist to be ready for a growing and rapidly aging population who have more complex care needs. And that is why the Minister of Health and Long-Term Care introduced this bill to build a publicly funded healthcare system centred around the patient and redirecting money where it belongs to frontline services to improve patient experiences and provide better and more connected care. As the minister said when first outlining our government's plan to strengthen our public healthcare system, the people of Ontario deserve a connected healthcare system that puts their needs first. At the same time, the people of Ontario deserve peace of mind that this system is sustainable and accessible for all patients and their families, regardless of where you live, how much you make, or the kind of care that you require. Speaker, our new plan would improve access to services and patient experience by organizing healthcare providers to work as one coordinated team, focused on patients and specific local needs. Patients would experience easy transitions from one health provider to another, seamless transitions between hospitals and home care providers, with one patient record and one care plan. Our plan will also provide patients, families and caregivers help in navigating the public health care system at all times. It will integrate multiple provincial agencies and specialized provincial programs into a single agency to provide a central point of accountability and oversight for the health care system. This will improve clinical guidance and support for providers and enable better quality care for patients. Our plan will also help move our healthcare system into the 21st century by improving access to secure digital tools, including online health records and virtual care options for patients. Mr. Speaker, I was proud to see that St. Joseph's healthcare system in my hometown of Hamilton received a special mention in last week's budget. Part of our government's vision to end hallway health care is to support innovative partnerships between hospitals and other sectors to provide transitional models of care. And St. Joseph's embraces models that can be used as best practices right across the province. St. Joe's has been an early leader in connected care through their Integrated Comprehensive Care, or ICC program, which promotes integrated care to allow for seamless transitions and ease patients from hospital to home. Patients returned home sooner, resulting in a decrease in return visits to emergency departments. This is a model that is working for the Hamilton community and has the potential to work right across the province. Speaker, for too long, Ontarians have had to deal with layer upon layer of bureaucracy and administration when dealing with our healthcare system. Healthcare administration can be very messy and, in plenty of cases, very costly. The evidence is clearly outlined in the 2018 Sunshine List, the annual list of Ontario public sector workers earning over $100,000 a year. Over 15,000 of those on last year's list work in various areas of our healthcare system. That is over 10% of the public sector workers on the list. And do you know how much they earned last year, Speaker? Over $1.9 billion. That's almost $2 billion. The Hamilton, Niagara, Haldimand, Brantford alone had 72 employees on the Sunshine List, earning just under $9.2 million. Mr. Speaker, modernizing the health system will take time, but we will continue to listen to the people who plan and work on the front lines, including nurses, doctors, and other care providers, as we implement our public health care strategy, as we bring forward desperately needed and overdue improvements to health care in this province. And, Mr. Speaker, I would now like to hand over the, wand over to the member from Parry Sound, Muskoka.